Hey there, everyone! We're thrilled to have you join us in our video series where we explore different health conditions that can stick around for quite a while. In today's episode, we're focusing on a condition that impacts people from every corner of the world: diabetes. Let's think of diabetes as a situation where the body's sugar management system goes haywire. Our bodies use a special hormone called insulin as a key to open our body cells, allowing sugar from the foods we eat to enter and be converted into energy. However, in people with diabetes, there's an issue with this key. Either the body isn't producing enough keys, or the keys it does have aren't working properly. What this means is that the sugar is unable to get into the cells where it's needed, and instead, it starts to pile up in the blood. When sugar levels in the blood remain high for long periods, it can cause a ripple effect of problems throughout the body. It can impact your heart, eyes, kidneys, and nerves, and can even mess with your blood vessels. Besides these health issues, having high blood sugar levels can also interfere with everyday tasks. It can mean needing to frequently monitor your blood sugar, taking medications regularly, and paying close attention to what you eat and how much physical activity you're getting. Coming to terms with diabetes, understanding its triggers, recognizing how it can make you feel, and knowing how to keep it under control if you have it, is super important. Our goal with this video is to break down everything you need to know about diabetes in a way that's simple and straightforward. Ready to get started? Let's dive in. We know that diabetes presents in two main forms, right? One is called type 1 and the other is type 2. Type 1 diabetes can be a bit of a head-scratcher because it happens when your body's own security team, known as the immune system, mistakenly goes after the good guys. In this case, it targets the cells in your pancreas, which are the ones that make insulin. Unfortunately, at this point in time, we don't have a surefire way to stop this from happening. On the other hand, we have type 2 diabetes. Now, this is a different ballgame because there are actually many things you can do to lower your chances of getting it. One powerful weapon in your arsenal is keeping a healthy body weight. You don't need to chase after a model-like figure, but aim for a weight that is considered healthy for your age, gender, and height. You can help maintain a healthy weight by enjoying a well-balanced diet with lots of fruits, vegetables, lean meats, and grains that are good for you. Just remember, eating right is about balancing what and how much you eat, giving your body enough fuel without going overboard. Exercise goes hand in hand with eating well. It's not about suddenly deciding to run a full marathon, but rather about finding things you like doing that also involve moving around. It could be dancing to your favorite tunes, going for a stroll in the park, cycling around the block, or playing a game of soccer with friends. The goal is to make sure you're active and moving for most days of the week. Of course, you also shouldn't forget about regular checkups with your doctor. These appointments are important for keeping an eye on your blood sugar levels. If your doctor starts to see something that's not quite right, they can help you figure out the best plan of action, whether it's making a few lifestyle tweaks or starting a new treatment. Remember, when it comes to keeping type 2 diabetes at bay, every bit counts. Every healthy choice you make is a step towards a healthier you. When you have diabetes, there are some unusual things that you might start noticing about your body. One thing you might notice is that you're peeing a lot more than you usually do. This isn't about having an extra glass of water and needing to go, but rather feeling like you're running to the bathroom all the time. Along with peeing a lot, you might be super thirsty. It's like you can't drink enough water to quench your thirst, no matter how much you try. Some people with diabetes start to lose weight even if they're not trying to. This can be confusing because you're not dieting or doing extra exercise, but the weight is still coming off. Feeling tired all the time can be another sign. It's like you're constantly running on empty, even if you're getting enough sleep at night. You might also notice that things look a bit foggy or blurry, as if you're trying to see through a dirty window. Also, when you get a cut or scrape, it doesn't heal up as quickly as it used to. It might seem to linger for longer than normal, which can be frustrating and worrying. If you, or someone you know, are experiencing any of these things, it's important to see a doctor. These could be signs of diabetes, and your doctor can help figure out what's going on and what the best next steps are. To find out if you have diabetes, doctors will need to check the amount of sugar in your blood. They do this by taking a little bit of your blood and testing it. There are a few common tests they might use. One is the fasting blood sugar test. For this test, you can't eat or drink anything but water for 8 hours before the test. Then they check your blood sugar level. Another is the oral glucose tolerance test. In this test, they check your blood sugar level, then give you a sugary drink and check your blood sugar levels again every 30 to 60 minutes for up to 3 hours. The HbA1c test is another test they might use. This one doesn't look at your blood sugar at just one moment in time. Instead, it tells the doctor what your average blood sugar level has been over the past 2 to 3 months. It's a bit like getting a report card on how your blood sugar has been doing over time. If you have diabetes, your main goal is to keep your blood sugar levels under control to avoid any health problems. How you do that can be different depending on the kind of diabetes you have. But everyone with diabetes can benefit from eating healthy foods and moving their body regularly. For people with type 1 diabetes, their body can't make insulin, so they need to get it another way. That's where insulin therapy comes in. This means taking insulin through injections or using an insulin pump. People with type 2 diabetes might start by taking pills to help their body use insulin better. Or they might need to inject a type of medicine that's not insulin but helps lower blood sugar. Some people with type 2 diabetes might also need to take insulin at some point. Remember, everyone is different. Your doctor will work with you to find the best way to manage your blood sugar levels. With type 1 diabetes, there's nothing you can do to prevent it because it has to do with your body's defense system attacking its own cells, and that's something we can't control or prevent right now. However, with type 2 diabetes, there are some things you can do to lower your chances of getting it. One of these things is to try and keep a healthy weight. Eating healthy foods and not too much can help with this. It's also a good idea to move your body and exercise regularly. You could ride a bike, dance, play a sport, or even just go for walks. Also, going for regular checkups with your doctor is important. They can check your blood sugar levels to make sure everything is okay. This way, if they start to see a problem, you can start working on it right away. Having diabetes means there are some things you need to do every day to stay healthy and feel your best. One of the most important things is checking your blood sugar levels. This helps you make sure your sugar levels aren't too high or too low, which can make you feel sick. To do this, you might use a little machine called a glucose meter, which uses a tiny drop of your blood to measure your sugar levels. Eating healthy is also a big part of living well with diabetes. This doesn't mean you can never have your favorite foods, but you'll want to focus on things like fruits, vegetables, whole grains, and lean proteins most of the time. And don't forget about exercise. Moving your body regularly can help keep your sugar levels in a good range, plus it's great for your overall health. Taking your medicine is another important step. Your doctor might give you pills or insulin shots to help your body keep your sugar levels in check. It's really important to take these just like your doctor tells you to, even if you're feeling good. Regular checkups with your doctor are also a key part of managing diabetes. These visits give your doctor a chance to see how you're doing, answer any questions you might have, and make sure your treatment plan is working well. Remember, living with diabetes can sometimes feel overwhelming, and that's okay. If you're feeling alone or stressed, there are people and groups who can help. You might find comfort in talking to other people who are going through the same things as you. They can be a great source of support and advice. We've talked about a lot today, haven't we? We've learned that living with diabetes can feel challenging at times. And you know what, that's normal to feel that way. But there's a silver lining to it all. When you really get to know what diabetes is and how it works, you can take steps to manage it and live a really healthy life. By managing your diabetes effectively, you're doing so much for your body. You're giving it the energy it needs to power through your day. You're lifting up your mood and overall feeling of well-being. And the icing on the cake is, you're greatly lowering the risk of serious health problems that diabetes can sometimes lead to, like heart disease or kidney damage. So, if you're feeling like this is a lot to take in, that's okay. If you still have questions, or just want to know more, we've got you covered. We've provided some links below this video, right in the description. These links are like little doors that open up to even more information about diabetes. This video is just a starting point. Think of it as a roadmap to understanding diabetes better. But remember, your doctor or healthcare provider is your main guide. It's absolutely crucial that you have regular chats with them about your health. They know your health history, they understand how your body works, and they're the best people to give you advice that's tailor-made just for you. So never hesitate to reach out to them.